It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in this week's episode, I want to shed light on the question, tracheostomy and weaning off the ventilator in intensive care. How long can it take? If your critically ill loved one has been in intensive care on a breathing tube or endotracheal tube on a ventilator and in an induced coma, and now has a tracheostomy or a trach, there are several reasons why your critically ill loved one required a tracheostomy. Most of the reasons for a tracheostomy in the first place you'll find are outlined in related articles and videos that we have on our website. So the articles and videos where you can find if a tracheostomy is appropriate in the first place are how long can a breathing tube or an endotracheal tube stay in. The other article and video you can have a look at is how long should a patient be on a ventilator before having a tracheostomy? And the other article and video is what are the risks and benefits of a tracheostomy? If you want to read those articles or watch the videos, scroll below this video and click on the relevant links. If you're watching this on YouTube, click on the link below this video. That'll get you to our website where you can have access to all of those free resources. So in today's episode of Your Questions Answered, however, I'll give you answers to how long it should take your loved one to be weaned off the ventilator and the tracheostomy in intensive care. Before I go into the details to answer today's question, let me share, however, a word of warning with you when it comes to tracheostomies in intensive care that is specific for our audience and clients in the United States. A tracheostomy is often used as a money saver in intensive care in the United States and also as a vehicle to manage an empty, quote-unquote, in-demand and very expensive intensive care beds. Why? Well, I'm so glad you asked. Because an in-demand intensive care bed costs around $5,000 per bed day. ICUs are wanting to empty their beds, and they do so by doing a tracheostomy and sending patients to LTAC, which are also known as long-term acute care facilities. If you are finding yourself in a situation where the ICU is suggesting a tracheostomy, you need to make sure that your loved one can stay in intensive care for as long as it takes to wean your loved one off the ventilator and the tracheostomy instead of going to LTAC. Why? Because mechanical ventilation and tracheostomy requires the specialist skills of ICU doctors, ICU nurses, ICU physios, respiratory therapists, etc. LTACs or long-term acute care facilities do have none of those skills available whatsoever. There are no ICU nurses, no ICU doctors, etc. in LTAC. The only genuine alternative to a long-term stay in intensive care or LTAC with tracheostomy and ventilation is intensive care at home services, where ICU nurses provide services up to 24/7, and I will explain more about that in detail in a moment. But I can't tell you how many families come to us when they have a loved one in LTAC, and they are literally begging us to help them get their loved one out of LTAC and back into intensive care. We can certainly do that as part of our professional advocacy and consulting service. However, it is much smarter to ask questions in the first place, making sure your loved one isn't going to end up with a tracheostomy unnecessarily. If your loved one could have been weaned off the ventilator and the breathing tube in the first place. We can also help you advocate successfully to keep your loved one in intensive care after tracheostomy. And again, we have done this numerous times. And we have links to case studies, again, below this video, how we help our clients to stay in intensive care instead of going to LTAC or long-term acute care after having a tracheostomy. So go and check out the case study. On to answering the question. So a tracheostomy is, generally speaking, a straightforward procedure in intensive care, and after a tracheostomy has been inserted, generally speaking, the weaning process for your critically ill loved one to come off the ventilator can be started immediately. That being said, before a decision for a tracheostomy has been made, there's a very good chance that your critically ill loved one has been or was placed in an induced coma. An induced coma, generally speaking, is necessary for intubation. Intubation is also known as an insertion of a breathing tube and an endotracheal tube for mechanical ventilation, so that your loved one is able to tolerate the breathing tube or endotracheal tube. Therefore, a tracheostomy tube is so much easier to tolerate for your critically ill loved one, and he or she doesn't need any sedation. Sedation are drugs that make your loved one sleepy and also manage pain. Again, for mechanical ventilation with a breathing tube or endotracheal tube, an induced coma and sedation was necessary. Therefore, sedation can be weaned, reduced, or even completely discontinued after a tracheostomy has been inserted. Therefore, the number of drugs given for sedation and pain relief can often be minimized or can be completely discontinued, which is a good thing. With the sedation minimized or ceased, your loved one should come out of the induced coma and should then be ready to take the first steps to be weaned off the ventilator and the tracheostomy. The first steps to being weaned off the ventilator and the tracheostomy can often be taken on the same day the tracheostomy has been done. Sometimes there can be delays, however, the goal should always be to wean your loved one off the ventilator and the tracheostomy as quickly as possible. Those first steps are usually to reduce support from the ventilator and let your loved one do more of the work required to breathe spontaneously, while still getting support from the ventilator, and then the next step is to take your loved one off the ventilator completely for a few hours and just support your loved one with an oxygen mask, also known as a trachea mask, trachea hood, trachea shield, or trachea collar, which is just attached to the tracheostomy but not actually attached to the ventilator. That process usually gives you, your critically ill loved one, and the intensive care team a good indication of how long the process might take to wean your loved one off the ventilator. The frequency and length that your loved one stays off the ventilator should increase day by day, with the goal to be weaned off the ventilator within a few days or a week or two at the most. And again, I've broken that down in even more detail in another article and video, how to wean off ventilation and tracheostomy step by step. Again, you can click on that article and video below this video in the written version of this blog. So that timeline is if all goes well and as planned. Sometimes your loved one may stay off the ventilator during the day and go back on the ventilator again during the night until he or she can be without the ventilator for 24 hours. After your loved one has been without the ventilator for a few days, he or she should be able to have the tracheostomy removed as well. If your loved one has a good strong cough and after a swallowing assessment has been done. Depending on the underlying admission scenario and other medical issues that your critically ill loved one is dealing with, the process of weaning your loved one off the ventilator might not be a straightforward process as described, and numerous setbacks might delay and prolong the weaning process. The most common issues that might delay and prolong the weaning process are respiratory conditions such as pneumonia, COPD, asthma, pleural effusion. Also, a lung transplant, excess sputum production that requires regular and frequent suctioning via the tracheostomy, neurological conditions such as stroke or head or brain injuries, obesity, confusion and aggression, depression in intensive care or LTAC, lack of quality of life in intensive care or LTAC, lack of privacy and dignity in intensive care or LTAC, feeling helpless and not in control of the situation, disturbed day and night rhythm, lack of sleep or sleep deprivation, lack of natural daylight, and sometimes there can also be a psychological dependency on ventilation support, especially after many setbacks and failed trials to come off the ventilator. These are the most common scenarios where a weaning off the ventilator with a tracheostomy can be delayed and therefore difficult, and the weaning process in intensive care or LTAC can therefore then take many weeks and many months before a discharge out of intensive care is possible. After the clinical issues are taken care of in intensive care, you may find that your loved one gets depressed in intensive care because of the lack of quality of life, the feeling of helplessness, the lack of privacy and dignity, the often sleep deprivation, and because of the disturbed day and night rhythm. And this can turn into a vicious cycle with the ventilator dependency triggering the depression and the depression triggering the ventilator dependency. This is especially true the longer your critically ill loved one stays in intensive care or LTAC. Increased length of stay in intensive care, depression and lack of quality of life usually go hand in hand. This means that your critically ill loved one might get psychologically dependent on the ventilator because of the reasons outlined before. And again, this often delays the process of your loved one being able to breathe without the ventilator. There are a growing number of patients in intensive care that are long-term ventilator dependent with tracheostomy, and they are therefore trapped in intensive care or LTAC with no quality of life and often with no perceived alternative but to stay in intensive care or LTAC for long periods of time without ever leaving intensive care or LTAC. Those patients and their families in intensive care or LTAC feel like they have no control over the situation, and they therefore feel like they are at the mercy of the intensive care doctors and nurses. So what's the solution to this dilemma? Well, after a few weeks or after a few months in intensive care or LTAC, because of the ventilator dependency, there is a relatively high chance that your critically ill loved one is getting weaker and weaker and is losing the will to live. The inhibiting and limiting intensive care environment, where quality of life or quality of end of life cannot be achieved, are leading more often than not to a downward spiral for your critically ill loved one. And many intensive care units or LTAC may actually tell you that because of the inability for your loved one to move forward, that they may have to quote-unquote withdraw treatment or quote-unquote limit treatment to let your loved one die. This, from my experience and perspective, would be completely inappropriate and also very sad. And it certainly doesn't have to be that way, irrespective of what the doctors and nurses in intensive care or in LTAC are telling you. In some countries now, mainly in Australia, also parts of the United States and Germany, specialized, holistic and comprehensive intensive home care nursing services are available to take your critically ill loved one home so that he or she, but also you as a family, can have quality of life, or in some instances quality of end of life. So please have a look at intensivecareathome.com. That's again intensivecareathome.com. Usually, with services like intensive care at home, quality of life can be restored very quickly, and patients and their families have real control over their lives, and they are far less dependent on a regimented, institutionalized, sterile and clinical environment. Some ventilator-dependent adults and children are able to go back to work or go back to school, go back to university, kindergarten with a support structure of intensive care at home. Intensive care at home services provide 24/7 care and provide similar services compared to intensive care just in a home care environment, where weaning off the ventilator is possible in a much more patient and family-friendly environment. If you are living in an area where such services are not available, we have more resources prepared for you that will help you to make informed decisions, have control, power, and peace of mind, and so that you can also influence decision making. These reports and ebooks and videos will give you massive behind the scenes insight that is crucial for you to make informed decisions, get peace of mind, have control, power, and influence. You shouldn't and you don't need to take for face value what intensive care units or LTACs are telling you. So go and have a look at some ebooks, for example, the 7 answers to the 7 most frequently asked questions if your loved one requires mechanical ventilation with tracheostomy. Also have a look at Follow this proven system to avoid the 3 most dangerous mistakes you are making but you are unaware of if your loved one is a long-term ventilated patient with tracheostomy. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section For more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me. Find international phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone, via Skype and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update